welcome to Project 31's video channel. I'm Jane Wilson. I'm the CFO for Project 31, and we've got Jennifer Harrod, who is our nurse navigator. And Jennifer, tell us just a little snapshot of kind of, how you came to find Project 31 and a little bit about your history.
Sure. I actually, before I was ever diagnosed, I was at a cancer center with my father, and my father was diagnosed with lung cancer. Saw a Project 31 flyer and thought, oh, this is cool, but I don't need it, put it back. So fast forward to 2018 when I was diagnosed, and the nurse navigator at the center, the imaging center, actually gave me a brochure. And so I was just at a spot where I didn't know what to do, didn't know who to turn to, just so lost.
And you're a medical professional.
Oh, yeah.
To hear you say that makes me wonder about people like me who have no medical background.
Right? Oh, I think you hear the word cancer,
yeah,
and your brain just turns off.
Yeah.
So it does not matter if you're a nurse, you have no idea what they're saying. It's like Charlie Brown.
Yeah.
I have no idea. So I just immediately shot an email to Project 31, got a care package in the mail, and I was able to sit there and read Sarah's book and just learn more about it, find out where their meetings were. It just helped me so much on my journey.
Wow.
I wasn't really able to let down and be myself until I went to that first meeting.
Wow.
And just cried the whole time. But,
wow.
Yeah.
We're so glad you're part of our... Now, not only are you on our leadership team, you're part of our staff, too. You recently were able to come on staff with us and be working with us way too many hours, I'm sure. But it's okay. I know you do. I know you love it. So you get a lot of questions from our newly diagnosed patients who, like you, found our brochure or somehow found us on the web or wherever they find us. They find us all kinds of places, thankfully. And so they reach out to us and they say, help. And then usually you call them back or touch base with them however they want to meet.
Right.
And what do they want to know?
So a lot of times, just kind of tell them a little bit about Project 31, where our meetings are.
Mm-hmm.
And then a lot of times they'll just want tips. I don't even know what to ask my doctor. I don't even know what to do. And a lot of times I'll just give them little tips, little pointers, just to help them along the journey to get them started, because they're paralyzed with the fear when you first hear that word. So I always recommend taking somebody with you, and I jokingly refer to it as your secretary.
There you go.
So somebody to take notes, somebody to listen, and so whenever you get home and you go, I have no idea what they just told me, they can refer back to the notes. I took one of my best friends, and she would write everything down that the doctor said, and I'd go back and read it and go, I did
Where
not.
was I when he said that?
Right?
Yeah.
I was not in the room.
Yeah.
So I think that's a big thing. And if during COVID, I would recommend, always recommended to people, if somebody can't come with you, maybe they're at home, ask the doctor and just put your phone, call them, put them on speakerphone, and have them take notes over the phone.
Can we FaceTime? Whatever.
Right.
Yeah.
So even if you don't have somebody local that can go with you, if somebody's out of state, that's okay. Make that phone call. Doctors do not mind that.
No, they really don't. And they're very accommodating. All you really have to do is ask.
Definitely.
And I've not met, especially an oncology doctor, that's all uptight about what's being said in the room. And they want more ears to hear, right?
They do. They really do. And, on that topic, if your oncologist is maybe not the right fit for you, maybe they're not encouraging you to ask questions, maybe they're not educating you, or you're just not a good fit, don't be afraid to ask for a second opinion. Don't be afraid to go and get a second opinion.
That's true. And even you can still stay usually in that same network,
Definitely.
maybe even the same office, but just a different oncologist. Right. Somebody that you really relate to. I know, for instance, in my group of guys, it's guys and gals, I think there's 6 or 8 of them.
Right.
And every once in a while, my guy would be out and I would have to meet with one of them. And I'd think, oh, yeah, you're nice. I could work with you. So you're not just stuck with one choice usually.
Right. And that's it's the great thing about it. Some people think, oh, well, I'm just stuck with this person.
No.
And you're not.
You're
You do
not.
have options.
Yeah. I got a second opinion on the surgery part of it. So the oncology part of it, I liked my guy. He was a good fit. He kind of he and I meshed. But the first surgeon that I met with, I was like, and I think that's just maybe surgeons.
Definitely can
because
be.
the second guy was much the same, but I did kind of like him a little better. And also, I just frankly wanted another opinion.
Right.
I really did want a second opinion. I wanted, before they started whacking things off, I wanted to make sure that, that was necessary. So that's good advice.
I agree. And I also encourage people to ask the doctor for copies of their pathology reports, for copies of their scans, and get a copy of them. Most doctors do not mind at all. They'll print them off for you and give them to you.
And do you find that's beneficial for the patient? Why? Why would that be beneficial?
I find it beneficial because then when they go back and somebody may ask them a question, so what's your diagnosis? Are you estrogen, ER positive? Are you progesterone, PR positive? A lot of people go, I have no idea.
Right.
What stage are you? I have no idea.
Right.
So just having those things so that you understand your diagnosis a little bit better.
And if they look at that and still don't know what it says, that's something you can help them with, or their doctor could help them with as well, right? Somebody who speaks the lingo.
Definitely. Nurse navigators are great. If your center has a nurse navigator, reach out to them, ask them. I have met with people just going over their pathology, explaining it to them, just so they have a better understanding, because it's a different language.
It's a whole language that an accountant doesn't understand, right? I don't understand most of that medical terminology, and you have to Google it, look it up, and then I think you still have a kindergarten level understanding, maybe at best, of what it means, and maybe a misunderstanding. Definitely. And sometimes that's not good.
No, and I tell people, just dumb it down for me. If I'm dealing with accounting or something, I'm like, okay, I'm a kindergartner, dumb it down.
Right.
I do not get all that.
I told somebody one time, I said, having cancer to me felt like driving down the Autobahn freeway in Germany at like 100 miles an hour, trying to read signs in a language I didn't understand and hoping I didn't miss an exit.
Definitely.
That's what it felt like to me. I was just like, so much was being thrown at me, that I knew I was missing things.
Exactly.
I knew I was just missing things. And so then when they say, well, because you're estrogen negative or because you're estrogen positive, you can or can't do this or that. And you're like, no, I don't know that. Explain to me why I can or can't do the thing you're talking about. I can't take that drug, or I shouldn't eat soy, or
Right.
all the things. I need more info, right?
Exactly. And you don't know what you don't know.
No.
So
You get to learn a lot when you have cancer.
Oh, yeah.
It's a big learning experience, right?
Even for me as a nurse, there was so much I had no idea.
Wow.
So
That's scary. That's kind of scary, really, when you think about it. So what else do they ask newly diagnosed patients? What else do they want to know?
Newly diagnosed, it really varies. A lot of them have questions about their insurance. Some will have questions, about resources that are available. So I can help with navigating them to different resources that may be available throughout not only just Oklahoma City, but some national ones that are out there, and lead them to those. So those are always very helpful when they ask those questions.
Sure.
There's just so many different aspects that cancer touches on in our lives that I really try to educate women to advocate for themselves as well, because you're your own best advocate.
For
so
sure.
if you have questions, if you don't feel right with something, you need to advocate. If you get home from the doctor's office and you go, gee, I really don't understand what's happening. I don't understand what test is next. Call your nurse.
Yeah.
Ask them, because they do not mind. That is their job. And the better educated you are, then the better patient you're going to be, because you're going to be able to help yourself and help them in the long run.
Right. I mean, I talk to women all the time who say things like, well, the doctor prescribed this for me, but then I just didn't like how I felt when I took it, so I quit taking it.
Right.
Did you tell anybody you quit taking it?
Right.
Like, people need to know that maybe, And not that you can't quit taking it. Definitely you have control over your own body. But maybe you ought to let somebody know. Like, for instance, antidepressants. Like, they don't want you to just stop taking those, right? Just one day, just decide that you don't want to take those anymore. That sometimes, those are the things you don't know that you don't know, right?
Right. Yeah, they'll taper you off of those.
Yeah.
If you're hormone positive and they put you on a medication for that, there's a reason why they put you on them. But if it's not working for you, if you're having too many side effects, there are other medications they can put you on. There's other medications that they can help with the side effects. So there's options out there. But if you're not communicating with your nurse or your doctor and you just stop it, that's...
Well, and I always felt like if I'm having a problem with this, I'm not the first person who ever had this problem.
No.
I'm not. No. I'm not such a unique unicorn that this has never happened to anybody else. So I kind of got over myself in that area. I never wanted to be a bother. I always wanted to be like, the perfect little patient who got tapped on the head and went home and did what she was supposed to do. But sometimes you have issues, and they need to know about those issues.
You do, especially if you're going through chemotherapy.
Yeah.
You may have side effects. You're like, oh, well, I just think this is normal. It'll go away. Some of those... There's things that can be done for that. Or they can give you a medication, they can slow down the chemo, whatever.
Right.
You have to talk to somebody about those.
Yeah.
So don't suffer.
Yeah, you're not a bother.
No.
You're not a bother.
Not
That's their job. That's their job.
I definitely agree.
So when you talk to a new patient, I mean, I know how I felt when I was newly diagnosed, and you mentioned how you felt, but is that common to everybody that we all just feel like overwhelmed is the first sense I felt. Overwhelmed and out of control.
Yeah, I really think it is. From the majority of the patients that I've talked to, yeah, they're just overwhelmed. Their anxiety level is so high and you don't realize it.
Yeah.
But you are overwhelmed.
Yeah.
For me, I was overwhelmed with I'm trying to work, I'm trying to take care of others as a nurse, as a mother, as a wife. And you're just overwhelmed. Now I've got to call insurance companies and figure out who takes my insurance, just those things.
Schedule time off.
Yes.
Figure out where the extra money's going to come from to meet your deductibles. I mean, there's a lot.
Right.
There's a lot.
And sometimes it's good just to talk to others that are going through that, to talk to others that really get it. Because I'll tell you what, my husband, I know, loves me and will do anything for me. But there's some things they just don't get.
Yeah.
They just don't understand, and really talking to other survivors really helps with that and did for me.
Yeah, I didn't want to talk to my husband about it a lot because I felt like I needed to assuage his fears that I was going to die or be sick.
Yeah.
And so I was like, I can't comfort you and manage this panic all at the same time.
Right.
I can't do that.
Exactly.
It was too much for me. So I tended not to talk to him a lot about how I was feeling at the time. I really pushed that down the road. Well, then by the time you push it down the road 6 or 8 months or a year, and now all of a sudden you're ready to talk to him about it, then he's all, aren't you better now?
Right. It's over.
It's over.
Why are you still worried about this?
Right. So I think that's just a woman thing. We're trying to take care of everybody in our lives, besides us.
And it's just, you're just trying to make it through to the end with your treatment. It's just keep on going. Go on that train and ride it to the end. And sometimes you don't always deal with those emotions right at the beginning.
At the moment, right. And we like to encourage all of our ladies to definitely reach out to our community. If you've considered going to counseling, sometimes for me, that's the first time I ever did was when I was going through breast cancer. So there are resources. People like Jennifer can get you hooked up with all kinds of great counselors or a network that's, available for you. There are options. There are people to talk to. And if nothing else, there's Project 31 Zoom to come in and listen in on and
Correct.
feel like you're not alone. I think for me that was big, feeling like I wasn't alone.
Definitely.
Yeah. Well, Jennifer, we love what you do for our group.
Thank you.
We love what you do for our ladies. And if you like our video, be sure and hit the thumbs up and subscribe. And thanks for joining us. We'll be back soon.
Thank you.